Hello, students, and welcome to the analysis of recall questions of forensic medicine in today's INI-CET exam. In total, we have seen that there are 7 questions which we are going to discuss in this segment of forensic medicine. So let's not waste time and let's begin towards the discussion of our first question. The first question is there is a patient of gunshot injury who presents to you in hospital, or maybe he's dead, but the question says who presents to you. Only an abrasion collar, only an abrasion collar is seen apart from the entry wound. So in this question, what we can see is that there is an entry wound. Let's say this is an entry wound which may be seen on the dead body, and around that entry wound there is a presence of uh, what we call in forensic as abrasion collar, right? And question is fairly simple. What could be the possible range of shot? If you want to understand the possible range of shot, just understand this concept very simply, that if we have a gun which has been fired, there are few things which come out of the gun. The first thing that come out of the gun is fire itself, and wherever there is fire, there is bound to be presence of smoke. So we have smoke coming out of the barrel, and apart from fire and smoke, the third thing which comes out of the barrel is the unburnt or partly burnt gunpowder particle matter. So we have unburnt or partly burnt gunpowder particle matter also coming out of the barrel, right? Now, if these things are going to strike a person, they are going to produce certain impact on the body, right? What are the impacts that they produce? Smoke. It produces blackening. Fire produces burning or singeing of the area, and gunpowder particles, they produce what is called as gunpowder tattooing. Okay, so we have blackening, burning, singeing, and tattooing effects that could be seen along with the entry wound, which is produced by the bullet itself. Now, when bullet is entering into the body, as the bullet is rotating on its axis also, because of the rotation of the bullet with the edges of the skin through which the bullet is passing, the bullet causes friction in that area around the entry hole. And that friction is visible to us around the entry hole as abrasion collar. So abrasion collar is an outcome of bullet entering into the skin itself. So abrasion collar is directly produced by the bullet, right? Now, in the question, we have been given that abrasion collar is present and an entry wound is present. There is no blackening, no tattooing, no burning, or no singeing. If blackening plus burning plus tattooing is present, we are talking about close range. Okay. If there is blackening plus tattooing, that is no burning is present, it means that fire could not reach the person. It is called as near range. Okay. If only tattooing is present, it could be near to something called as an intermediate range. It could be near to intermediate range. And if the person is in contact with the weapon, then a muzzle impression mark may be seen around the entry wound also. So it could not be contact range because no such finding has been given to us. What has been given to us is that only abrasion collar and an entry wound is present, which means the bullet has been shot from a distance which is quite far from the body, so that neither fire nor smoke nor tattooing particles could reach the body, and such a range is called as distant range. So correct answer here should be distant range shot. Okay, let's move on to our next question. The next question is a fairly straightforward question, doesn't need much of a discussion. Blackfoot disease is caused by, the answer is arsenic poisoning. It's an outcome of arsenic poisoning. Basically, it's a peripheral vascular gangrene that happens due to chronic arsenic exposure. Next question. Now, this is kind of a tricky question that students have told. They have told that in exam there was a photograph which showed uh, appearance of blackish appearance on the chest and abdomen with certain reddened areas of kind of burst blisters, and there was a blister also which probably was visible on the photograph. The best photograph which I'm lining up for you is something like this. So blackened areas on the chest we can see on the photograph, and then there could be presence of a big blister somewhere in the lower part of the chest, and maybe some areas of reddened, small blisters, or probably what I understand is those are blisters which have been broken. So the raw area underneath the base of the blister, that is red in appearance. Now, the question was fairly simple. The photograph was shown and it was asked, what could give rise to this appearance? The options are antemortem burns causing blisters, barbiturate poisoning, edema due to chemical burns, or pemphigus vulgaris. Right? Now, if we look at this question forensically, right, there are three important choices which correlates with the forensic aspect of the question. That is option A, B, and C. Pemphigus vulgaris also tends to have eruptions on the body, but then when these eruptions subside, they end up creating eroded skin in that area, right? So in the photograph, there was no eroded skin that was shown. Okay, so this kind of rules out. Chemical burns, they generally are also ruled out by the finding that when chemical burns happen, the area is reddened. Uh, they can give rise to generation of certain blisters, but their appearance is not blackish if it is not any corrosive burn, which can lead to generation of eschar. And by the time those eschars will be formed on the body to give a blackish kind of an appearance due to acid burns of the skin, blistering would not be seen. Okay. So it doesn't look to be a picture of an edema due to chemical burn. Third is barbiturate poisoning. Now, barbiturate poisonings can lead to generation of blisters, very, very commonly called as barbiturate blisters. But the finding of those blisters is very pathognomic. Those blisters generally are generated in those areas where the skin is under pressure, like interdigital cleft areas where the skin is in constant friction, like forearms, when you keep forearms on desk, like inner aspect of thighs, okay, or when we sit on a chair, gluteal aspect. So those are the areas where barbiturate blisters tend to develop, and when these blisters become old, they also tend to give blackish appearance to the skin. But in the photograph, a chest and an abdominal picture has been shown. So the area rules out barbiturate poisoning. So what we are left by default is antemortem burns causing blisters, as we have been shown that blisters of antemortem burns have red inflamed raw area beneath, which is called as the base of the blisters. So probably what was shown in the photograph was an ante-mortem burn uh, with blackening over the area. So the photograph was giving a blackened appearance with a blister being generated because of the ante-mortem burn, and just beneath it, few reddened areas were seen where probably there could have been certain more blisters which were broken. So underneath, reddened raw area appearance was visualized. So correct answer should be ante-mortem burns with blister formation. Okay, let's move to our next question. A person has died from drowning. So in the question itself, the cause of death has been given that a person has died from drowning. All are probable signs of ante-mortem drowning except. So question itself is asking probable signs, right? Not confirmatory signs. So any probable sign which could lead the investigator to a probability that yes, this could be possible in antemortem drowning could be a probable sign, right? So if you look at option water in stomach, is it possible in cases of antemortem drowning? Yes. Is it possible in cases of postmortem drowning? It may be possible, but largely if it is highly filled with water, it goes in favor of an antemortem drowning. Okay. So this is a probable sign. So it is okay. Second is washerwoman hands. Okay. Does washerwoman hand generate in cases of antemortem drowning? The answer is yes. Does washerwoman hands generate in post-mortem drowning? Or I should say in cases where the person is already dead and then the dead body has been thrown into water? The answer remains yes. Is there a difference between the two findings or appearances? The answer is no. In both the cases, whether it is an antemortem drowning or a post-mortem drowning, when that bleaching and hardening of hand and feet skin happens, which is called as soddening or washerwoman hands and feet, the appearance is same. It starts to generate in fingertips within the first 2 hours, and it progresses to the back of the hand in 24 hours, and same happens in cases of foot also. So it does not create any clear picture that whether this finding would be going in favor of an antemortem or a postmortem drowning. So is it a probable sign of antemortem drowning? The answer is no. This is not a probable sign of antemortem drowning. Diatoms test coming positive is a probable sign of antemortem drowning, and white froth coming from mouth and nostril is a very highly probable sign of antemortem drowning. So in this case, all are probable signs of antemortem drowning except the answer is presence of washerwoman hands and feet, also known as soddening. Let's move to the next one. Which one of the following is false? So statements are given. Adipocere occurs after body come out of water, which appears to be a correct or a true statement because adipoceres generate, we learn that, in high moisture content, right? Cadaveric spasm occurs in specific muscles. This is also a true statement because contrary to rigor mortis, cadaveric spasm does not involve the generalized muscles of the body. It only involves certain specific muscles of the body. Most commonly, those muscles are muscles of hand. Then third is post-mortem lividity is seen in lower limbs in death due to drowning. Now, this seems to be a false statement because in drowning, post-mortem lividity or post-mortem staining, as we say it, is more commonly seen in head, neck, and chest areas. Okay. And that too, if the drowning has a still water where the body is still, it is not rotating or revolving all the time. In lower limbs, post-mortem staining is highly expected to be developed in cases of hanging where the body remains erect so that the dependent portion of the body are the feet itself, right? And fourth option, you will see greenish color over the right iliac fossa is an early sign of putrefaction. This also is a true statement. When we see right iliac fossa discoloration coming uh, in a dead body, we say that it is the earliest external sign indicating that decomposition or putrefaction has begun in body. The timing of this right iliac fossa discoloration is 18 hours. We learn that when we go through the topic of postmortem changes. So in this question, which of the following statement is false? What appears to be false is option number C. Next is, which of the following is not a part of right slogan for snake bite treatment? Okay. So when we talk about snake bite treatment, there is a slogan available to educate all the peripheral caregivers, okay, in our country, which is called as right. It is also called as do it right. It is also called as do it right. So in a case of snake bite, do it right. What is do it right? Right is the mnemonic. You can say like that. It involves reassurance. You give reassurance to the patient. Then with I, it is immobilization. Okay. Then with GHT, it is go to hospital, right? Go to hospital goes with GH. Okay. Go to hospital goes with GH. And with T, it means tell the doctor. So to educate any kind of peripheral treatment to common public, what is being told to them is that whenever you have a snake bite victim, reassure the patient, immobilize the limb, go to the hospital, tell the doctor what you have seen. This is called as right slogan. Okay. So in right, what is not included is giving any incision to that area. So no incision has to be given. Next, this question again is a slightly newer kind of a question because it looks like a probably new kind of poisoning has been asked in this question after a long time. Let's read this question. Child went with grandmother to a temple, and while returning or after returning, he started to cry inconsolably. So the child is inconsolably crying. He is taken to a hospital where breathlessness is noted, sweating is noted. Uh, some people say altered mental status or altered sensorium was also given. The skin is cold, and then priapism, a very important indicator, was given in the question. Priapism was noted, and his capillary filling time was increased, and his respiratory rate was also increased. The question asked what treatment should be given. If you want to start to see what treatment could be given to us, this child in the question, we first have to identify that what could be the reason for this sudden, health status of this child. So it looks like uh, because nothing else has been given in the question, no trauma, no RTA, nothing else. It looks like the child has been intoxicated and acute intoxicating findings are present, right? But again, in the question, it was not given that the child has eaten something. So it looks like he has suffered from an irritant organic poison, that is animal origin, poison of animal origin. And two such irritant inorganic poisons or animals that come to mind are snake and scorpion. Now, priapism is one finding which goes in favor of a scorpion bite. Okay. Although in rare cases, snake bites can also lead to priapism, but literature says priapism can happen. It can happen due to parasympathetic effects of scorpion bite, right? Rest all the features can be seen in both the cases. The only other differentiating factor is the uncontrollable cry of that child, because in scorpion bite, the sting is more painful than a bite of a snake. So it looks like he had a scorpion bite. The sting is very painful. The child is crying uncontrollably with findings of priapism. Uh, so what should be given? The answer here is option B, prazosin. Okay, in this question, anti-snake venom was a choice. It has been reported. Prazosin has been reported as a choice. Adrenaline has been reported by certain student as a choice. And fourth choice probably was some other drug uh, that has not been correctly reported. So it has been kept as a question mark. But correct answer uh, is prazosin, because it looks to be a scorpion bite. With that, we come to this end. Hopefully, your exam was wonderful. For all those people who has given exam, I wish you all a very best of luck.